Okay, good afternoon, everybody. Looks a little thinner here. I think we're the only thing between you guys and happy hour, so we got the best slot today for sure. But thanks for being here. And I want to thank Rock Health for putting together a panel on employer sponsors, because I think it's really, really critical. For many of you very familiar with the employer landscape, but for those of you who are not, there's generally two types of employer plans in the broad sense. One is self-insured, so that the insurer takes the risk, and the other is, fully insured where the health plan takes the risk, and self-insured where the employer takes the risk. So most employer-sponsored plans, self-insured plans, want to make sure that they're managing appropriately in terms of the population. Not that fully insured don't also, but there's more risk for the self-insured employers. So we're going to be talking about that today. How many of you here today in the room are self-insured employers? Any? Okay. How about, is there one over there? Okay. How about digital solutions that have pitched to self-insured employers? Yeah, okay, there's more of you. All right, so we know that self-insured employers pay a substantial amount in terms of medical costs in this country, and they're a very, very critical customer. When I was doing consulting in the early days, and I'll give my introduction in a minute, there were a lot of B2C companies coming in with digital health. Now we know a lot of digital health is B2B. So very critical that we understand employers' issues, what employers are looking for, what are their challenges, and what's the future of employer-sponsored healthcare. So very excited to have this panel here today. A very quick introduction. I'm a physician by training. I have been in population health for 25 years. I've been a consultant to large employers for about 8 years now, helping them with their population health and innovation strategies. And I'm the national clinical leader for Strategic Benefit Advisors, and we are a partner of Rock Health. Fun fact about me, I've once wrote a screenplay, which actually was a comedy. Okay, now I will turn over to the rest of the panel to introduce themselves.
Yep, it's hard to follow, Louise. I'm honored to be on a panel with you and really happy to be here with Rock Health. Thank you. So my name is Shauna Kashyap, and I am the Vice President of Platform Partnerships and Strategy at Collective Health. Collective Health is a company that's helping self-funded employers administer their health plans. So when an employer decides to make that strategic step to not go fully insured, but to go self-funded, they have to administer a number of different things, including their medical, dental, vision, and pharmacy benefits. But then on top of that, they generally engage concierge support, engagement support, a number of different focused care solutions to help maternity benefits, and chronic care conditions. And then all of a sudden you have this Frankenstein approach, right, where you're managing a number of different solutions, eligibility, payments, reconciliation, and it becomes a lot to bear as a self-funded employer. In comes Collective Health. So we really streamline the experience for a member on the front end. So for a member who has all those amazing benefits for their employer, they have one place to go to get all of those benefits. But on the back end for the employer, we give them that same seamless integrated experience where we're handling all of the eligibility, where we're handling all the payments and the reconciliation. But then on top of that, we're giving them amazing data insights into what's working from an ROI perspective. So super excited again to be here and to be having this conversation.
Thanks for being on the panel. John?
Hi, I'm John Jackson. I'm Vice President of Strategic Relationships with One Medical Group. One Medical, we are a national primary care, both primary care in both a network of near-site clinics as well as on-site clinics. We are really looking to transform the way that healthcare is delivered from the inside. So rather than being external to the ecosystem, part of the ecosystem and transforming how healthcare is delivered, since most of us enter the healthcare system through a primary care encounter, whether that's a physical, a cold, an allergy, whatever that may be. So the way in which we've done that is to do a couple of things. One is we have built from the ground up our technology, and we did that with the idea at all of the time to focus on the patient as well as the provider. So make sure that on the back end, our providers are having a great experience. So those of you who are familiar with provider burnout in this country, it is a terrible problem. We try to address that by making sure our providers are part and parcel of how we develop our systems to support them, and then on the front end to make sure that it's wonderful for a delightful experience for our members, our patients, and change the way that whole experience works through both access and experience. Just in terms of what that means, it sounds so simple, and I feel particularly strange talking to a digital group about this, but one of the most impactful things for me personally when I joined One Medical was I had an appointment, and that appointment started on time. That was kind of a weird experience for me, but it did not start on time the way that United Airlines meets their leave the gate on time, i.e. back you away from the gate on time. No, it started on time because the physician came out, took me back for my appointment. My appointment began right then. Our physicians are the ones who spend the entire time with you. I never saw a medical assistant or anything like that. That is a surprisingly impactful thing for human beings, is what I found. And so that's what we're trying to do, and then connect that and coordinate care across the healthcare system to improve both the health of our members as well as the cost of care associated with them. Very excited to talk to y'all.
Great, thank you, John. Anand?
I'm Anand Parikh. I'm the General Counsel and VP Finance of Virta Health. What Virta Health does is we're an online diabetes reversal clinic. What that means is instead of sort of the usual diabetes paradigm of diabetes management, we can actually take folks with the disease and reverse it. And what I mean by that is get people's hemoglobin A1C below 6.5% and get them off all anti-diabetic meds. Our research is available, it's peer-reviewed, it's validated. We have studies going out to 2 years, and we've run a clinical trial in Lafayette, Indiana, that's now going into its third, almost fourth year. We work with employers, health plans, and other constituents in the healthcare ecosystem to make sure that our patients are receiving fully integrated care and reversing their diabetes in the most delightful way possible.
Great. All right. Will each of you give a quick fun fact?
I was going to say, are you going to let us off the hook?
No.
So I've had a bunch of really crazy jobs in my life, and I thought that might be one fun fact. So at one point in my life, I actually taught aerobics to women in the Middle East.
Wow. That's very interesting. We'll hear more about that later.
Yeah.
Okay, well, although I've been in healthcare for a lot of years, like more than 20, I actually have a master's degree in aquaculture from Auburn University, and I used to be a fish farmer.
Ah.
That's great.
By the way, a fish pond is a great analog for almost all human activities. Just catch me later, and I'll educate you.
I'm gonna take you up on that in the happy hour. My fun fact is, in my high school years, I had hair down to about here, and I was in a band called the Anderson Council. Not a good look.
Okay, great. Thank you all for being here today. I really appreciate it. And one thing I noticed as you were describing your organizations is that you are all very mission-driven and passionate about what you do, and you're really trying to help not only employers, but their members and dependents. And so really just want to thank you all for the work that you're doing before we get started. Okay, so let's start off with measurement, which is a big issue, especially in consulting. Employers are always asking us to comment on how are we going to measure these solutions? What are the metrics? What's the return on investment? And for us, we've seen a real shift in the marketplace, and maybe consultants are pushing it a little bit in terms of looking not just at return on investment, but value of investment. So let's talk a little bit about, your perspective on measurement, maybe what you're measuring and what you think is important to employers today.
Yeah, I think it's a really, really important question. So for an employer, I totally think it depends on where they're at, right, and what they're solving for. Somebody in San Francisco is definitely solving for retention, right, compared to folks maybe in the Midwest. So you have to think about that first. But more and more, you're right, we are hearing employers talk about value on investment and value of investment because it encompasses the really, really, really powerful and valuable measures of employee health, right? You get employee happiness, you get less sick days, you get retention, all of those amazing things. But with 6% annual increases in healthcare spend for employers, I think it still comes back to ROI, and it really comes back to how are they going to bend that curve, right? And so at Collective Health, we really try and take a rigorous approach to analyzing the different digital health solutions that our employers are using. Because when you're trying to look at the ROI on a digital health solution, it's really hard to think about whether or not that digital health solution actually caused that effect, right? So at Collective Health, we are able to look at a similarly situated person who engages with a solution and then somebody who is similarly situated, and we're controlling for as many factors as we can control who's not engaged with that situation. And so therefore we can really see whether or not that digital health solution is actually causing that effect. And I think that that's really important. And at Collective Health, we've really taken this really seriously and built a really experienced team to kind of drive that sort of analysis.
Great. And I've actually met your analytics team. They are fantastic.
They are fantastic. I think I agree with Shauna in terms of it's kind of particular to the employer. Like all employers are the same and all employers are different. To me, there's always a couple of components that they're looking for, Louise, in terms of value or cost. Mm-hmm. So one is, so Shauna mentioned, like here, they're going to be concerned about productivity in terms of retention, access, et cetera. So maybe they're going to value productivity, and part of productivity is, going to be associated with a lot of variables. One of those variables might be health. So there are also employers, and I think I meet with lots of benefits folks, and I think in general, they get a bad reputation. I think everybody thinks that the conversations are always just cost. Mm-hmm. What are you doing to reduce my cost? How are you going to? And I find benefits professionals who care deeply about the health of their employees, deeply about it. Now, there's always then also that component, which is cost, because they all have CFOs who want to know, well, I care deeply about the health too, but I also have to care about the health of the company in terms of finance. And so usually when you're out talking to an employer, they're going to order those things in some order based on their individual characteristics. They're either going to say cost is the most important thing to me, health is, access, so they're going to move those around, and when you're interacting with them, you have to understand what their priorities are and fit your particular, whatever your particular solution is, you've got to fit it to what their priorities are.
So maybe I'll play devil's advocate a little bit and say, in a tight labor market with a humming economy, maybe VOI, value of investment is super important, and maybe people are looking at all those other intangibles. I think once there is a downturn, I think people will start looking at what actually drives ROI. And I actually think it's really dangerous, especially for the entrepreneurs in this room, to shy too far away from that. I think that if you aren't constantly thinking about what ROI you're delivering to the organizations that you partner with, you're going to be left in the cold when there's a downturn. You're going to be the first thing on the chopping block, because someone like me is going to look and say, hey, this doesn't make sense, this is gone. And I think that it's really important, especially for a nascent industry like digital health, for all of us to be really grounded in that idea of we are going to return value to our customers. We live that. I think that's really, really important.
Yep, absolutely. What about satisfaction, member satisfaction? Are you measuring that? Do you think that's important to employers? And what about measures of performance, like business metrics?
Yeah, we definitely measure that, and in fact, at times, and we have actually put fees at risk to that. Mm-hmm. I would actually agree that more and more employers are putting less fees at risk there and putting more fees at risk on trend. Mm-hmm. So I think it is really important for employers, but even though we're not in a downturn, I think it's already important for employers, the other side of it.
Costs are always going to be important. It's a matter of how important and how they're going to put value. So what we see a lot also is, so like for us, NPS is extremely
Yes.
important, right? If we're not satisfying our members at the point of service, then we are not delivering value. It doesn't matter what happens downstream, because we will not be able to engage that member in their health. And if we don't engage them, then it doesn't matter how good the solution is, you're not going to get the value. So we've been focused on the NPS for a long time, and then at the same time, we also look at, because we're a healthcare provider, we look at the delivery in terms of what the outcomes are of the care we're delivering, and then always also have to look at the cost.
Right. So one of the big drivers, obviously, of ROI is engagement. And I've seen over the years disease management, care management, a lot of employers pouring a lot of money into solutions, and they're not getting an ROI. They can't even possibly get one because there isn't enough engagement. So what kinds of strategies have you seen to be effective, or have you used to engage members in your different solutions?
Yeah, I think at Collective Health, engagement is incredibly important to us. So we've been working on it for 5 years, right, since the very beginning. At Collective Health, actually 2 in 3 people engage with Collective Health in a meaningful way before they have a claim. 2 in 3 people. That's incredibly meaningful, right? Because that means that they are talking to us before they actually go and get care. I'm going to say something that's kind of controversial, but I kind of think that IDing people, using ML and AI to actually ID somebody that you think is going to be encountering some high-cost claim, or that you think should be somehow, you should have some sort of intervention with them, is table stakes, and everybody should be doing that. The hard part is to actually figure out how to engage them. Right. So at Collective Health, we have the table stakes done, and we're doing that. We're actually using AI and ML to really engage with the member in an intelligent way. So we're figuring out, for a certain profile of a member, what's the right way to engage with them, and iterating on that, correct? And then the second way we're doing this is really building trust with the member. And this isn't always ML and AI led, right? This is having puppy dogs at open enrollment, right? This is making sure that every time they call in to Collective Health, they get the same member advocate, so that they really trust us. And that means that when we do identify them and we do outreach to them, they actually answer the phone, they actually answer the email. One of the statistics that I love from a very, very early kind of test case that we did is we sent a communication out to women to encourage them to go get a mammogram. And 1 in 10 women went out and got a mammogram that wouldn't have otherwise gotten one other than Collective Health's engagement. That means that they trusted us to go out and get this kind of tough, test. And I love it because I actually think that we might have saved lives that way. And that is taking the ID and then the smart engagement and putting it together to drive results.
Great, thank you.
Yeah, it's a great question, and I love what Collective Health is doing. I think it's a challenge for all of us every single day. We focus quite a bit on trying to understand what is it that the member wants, what is it that the patient needs at a particular point in their life cycle, of whether it's life cycle of a disease, life cycle of life, whatever that is, and understanding what the messages are that resonate with those folks to engage them. I think a challenge for all of us in healthcare is that, we think about this every day. The typical person only thinks about it when they're sick. And then when they're sick, we put up all these blockades to them. We use language they don't understand, and we put up roadblocks to them getting care, and we make it hard for them. So eliminating those and identifying those opportunities where, whether through AI, ML, however you're doing that, is essential. And I think there's just fertile ground there. But I would encourage anybody in this space to also think about it in terms of the language, the literacy of how you're interacting with these folks. Because prior to coming to One Medical, I was at Stanford, and one of the things I did at Stanford was run they owned a small benefit advocacy company, and the calls we would get, the elementary questions that people had about the very, very basics of healthcare and coverage, et cetera, were staggering in terms of what they don't understand. And so I think that's a big issue for us all to look at and try and overcome.
So it's not only health literacy, it's literacy about the whole healthcure system, basically.
Yeah, I mean, when you're calling and your question is you don't understand what your deductible means, or what you don't even know what that term means, or you don't know what a claim is for the service you received, right? These are common questions for a benefit advocate. Common questions. I'm sure that they're feeling that the member advocates are fielding that at Collective almost every day.
Absolutely.
So from our perspective, engagement really centers around demonstrating value to three people in our value chain. And that's the patient, the provider, and the payer. And if we demonstrate that we're going to deliver value to each one of those people, we'll be successful and have been very, very successful in delivering industry-leading engagement. And the reason for that is, to a patient, we're telling you, hey, you've been pricking yourself with insulin for 20 years every single day. We can get you off insulin and lower your blood sugar. Mm-hmm. That is an incredibly compelling value proposition that leads to instant engagement. Just have people connect with you. They're like, hey, this is something I've got to check out. For the provider, we're going to help deal with some of the most challenging patients on your panel, the ones who come in and year after year, all you do is dial up the insulin a little bit, tell them to eat less and exercise more. It doesn't work. They come back, you dial up the insulin. We're going to take that person and we're going to send them back to you fighting fit and healthy to deal with the other conditions in their life that you can also help them with. And to the payer, I mean, we talked about ROI, right? You reduce meds, you get their hemoglobin A1C down, you reduce weight. I mean, those things yield very real, very immediate benefits, not only in the CFO's office, but also to the benefits leaders in terms of value delivered.
Absolutely. All right, maybe let's take a question from the audience now. What are the benefits of employer-sponsored healthcare over government healthcare in your experience, and what are the drawbacks? I'm
probably the only person on the panel who grew up in a government, a single-payer system. I think the single-payer system has a lot of benefits in that you don't think about entering in, when you're receiving any kind of primary care, you don't think about what is this going to cost me. You just go get care when you need it. And there's a lot of benefits to that. But I think in terms of innovation around healthcare delivery, it has to rise to a certain level of proof before it can be implemented. In many ways, this phrase that states are the laboratories of democracy, I think in many ways employer-sponsored health plans are the laboratories of healthcare. And there's definite value to that. Now, if you're at Walmart, you may be experiencing the best of that, but if you're at a smaller company, you may not be experiencing as much, but yeah.
Yeah, and I would totally agree with that. As a consultant, I've piloted a lot of different solutions with employers, and it really, for those employers that are receptive, can really be like a petri dish. Obviously, you want it to be positive outcome, but not a negative experiment. But yeah, absolutely. All right, so we'll start with John on this one. How are employers thinking about non-traditional care delivery methods, such as partnering with groups like One Medical, or direct contracting? And I don't think this is an either or, but how do you think digital solutions and primary care solutions will work together to bend the cost curve?
Yeah, I don't think it. Well, first of all, what's going on in the market in terms of what we're seeing and what I've seen for the last probably 5-6 years, employers are becoming much more activist than I have ever seen in my career. And what I mean by that is they are becoming disenchanted with their insurance providers. They are, for the most part, trying to minimize the services that they require, that they get from those large insurance providers. And they are saying, hey, I want to have a more direct relationship with the folks who are actually delivering the care. So removing people from the middle as much as possible and getting more transparency on how care is delivered and how care is paid for. So that, I think, is something that's not going to go away. The employers are getting more and more educated all the time around, and certainly, Louise, the folks you deal with, the large self-insureds, they have very skilled, sophisticated folks on their teams to do these kinds of relationships. I put these kinds of relationships together between Stanford and large employers in the Valley. The fully insured, smaller, I shouldn't call them smaller, let's just call them fully insured, they are developing those skills and starting to be more educated around them. So I think you have to be able to speak their language, and you have to be able to engage in that conversation with them, and they're going to ask, as a provider, they start asking really hard questions, and so it challenges us all the time to get better. I think it's a very good thing. In terms of digital interacting with primary care in those situations, again, it's all about, this is also then driving, again, all around the experience. What is the experience that's happening for their members, and are you enhancing that or not through whatever tools you're bringing to the table? And all of those tools now have to start working together. The employers are also becoming very frustrated by the lack of coordination between the various things they're bringing to the table in order to solve their problems. And so all of us, I think, are also challenged to play nice in the sandbox. We've got to figure out how to work together in order to deliver a solution. And, you know, we see that in the marketplace. We see some folks who are really open to that and some who are not.
Yeah, and let's move there, because we know that, you know, a lot of employers are getting what we call point solution fatigue. So they've got all these different solutions. They don't know how to integrate them. They don't know how to get people to engage. So they're looking for a front door in healthcare. So could you all comment on, you know, the concept of a front door, what that kind of means to you? What do you see out in the marketplace as being a front door, and how do you think that plays into employer-sponsored plans?
So in terms of a front door, I think for someone like us that treats a very expensive but potentially narrow health solution like diabetes, we are often asked that question, well, can you integrate with this front door or that front door? And we see lots of front doors. And they are of varying quality. And so I do understand the fatigue from the employer side. I think that the front doors are probably not delivering either the engagement or connection to outcomes like the employers would wish. And my personal view, not backed by data, just an instinct, is that we're going to see a bit of a pullback. That employers are going to start sort of disintermediating this intermediary, the front door, and start doing these things themselves by actually examining ROI and saying, these are the things that are actually delivering value, and I'm going to focus on a narrow suite of things that actually deliver value, rather than only this front door, which gives me access to the options that the front door thinks is best, or which are not vetted. Now, obviously, there are some companies, Collective being one, that do a really good job of making sure that partners are not just the ones that give them the highest commissions, but ones who are actually delivering value. But they might be an exception rather than the rule.
Yep.
Shauna?
Yeah, I mean, we don't take commissions, so that's 100% true. But I think these words, right, like meeting the member where they're at, the front door, it used to be the platform. When I think about that, I really think about, we're talking about how can you be relevant to the member, right? How can you actually cause a member to interact with you? And at Collective Health, when we faced this question, right at our very beginnings, we thought a lot about that, and we decided to do the super unsexy work of actually processing claims, right? I mean, so many people have said to us, why the heck would you build a TPA? Like, why would you process claims? And the reason is because of this relevance that I think that you really need to get for a member. If you're going to drive them to One Medical, if you're going to drive them to the diabetes solution that they need at the right time, because a member has to call into us when they have a claim, right? They're looking on our website to go through their benefits. They're looking on our website to find a provider, and we're taking all of that data in and we're combining it with prior authorizations that we also have to have because we're processing those claims, and we're taking that data in addition with historic claims data, the member's own and other claims data, right? And combining that and really figuring out how to be relevant for that member. So I do think that there's a lot of fatigue around that, but I think that as an employer or as a digital health solution, if you turn it on its head and really think, how am I going to be relevant for the member and for the employer, it makes a lot of difference.
Yeah, absolutely.
I'm not even sure it's the right question, the more I think about it. It kind of if you think about, it assumes that I know which house I'm looking for, right? So for example, is my 401k plan, which is a benefit, and my medical plan, which is a benefit, do I, as the individual, think of those the same way? So I, as the employee, when I go to look for information and you've created this front door, did you put my 401k behind that front door? And do I have to think, I still have to think, right? I still have to think, oh, right. I have to connect 401k and medical benefits, and then I know I go through that door over there. That's not what employees are good at. And so, again, I come back, the more I think about this, the more I think it's up to all of us to cooperate in order to, what we're seeing in the marketplace is our customers saying, hey, we want you to know about other stuff that we're offering. And they're going to ask that of each solution they have, so that you're always trying to maximize whatever is available to that individual, because that individual may not know what's available to them, and they certainly may not know where to go to find it. So even if you have a beautiful door, they're not sure that that's the right door for them. They just think it's a nice door, potentially. So I think it's a challenge, I really do.
And I think you're right. Very often, employees do not know what's available to them. That's a big problem in the industry. Let's take one more from the audience. Does One Medical or Collective Health share any risk with their clients to better align incentives?
Yep. So I'm happy to take that one first. So Collective Health does a lot of times put our fees at risk for trend, because we actually really believe in our engagement, and driving the member to the right care at the right time can actually have an impact on that 6% increase in trend. And more, like we talked about at the beginning of our conversations, employers are looking to see what you can do about that. And we're really confident in our abilities in that area. And like I mentioned, we have that amazing analytics team that really sits down with the employer and talks about what's important to that employer and figures out what's the right sort of fees at risk situation to do for that employer.
Great, thank you. John?
Yeah, so we will at times work on a risk-based contract, and based on very particular parameters, et cetera. We're happy to do that. So I guess yes.
Okay.
I'll just say one thing on that.
Sure.
We only price our contracts fees at risk. That is the only way in which we'll do business, because we were built to pull costs out of the healthcare system. So yeah, I'll add that in there.
Great. Okay. And what percentage of fees at risk? Is it variable?
It's everything.
Okay.
So unless we reduce A1C, weight, and medications, we don't get paid.
That's impressive. Okay. All right. Good. Here's a question from the audience that's the same as one that we actually prepared for this panel. How do employers evaluate digital health solutions, or how would you suggest that they evaluate digital health solutions? So we'll start with Anand.
I think that's a great question. And I would go back to what we talked about a little earlier, where I think it depends what you are optimizing for. I would suggest that the baseline always be some ROI. some type of return on investment. I mean, they're for-profit entities for the most part, and so they should be returning shareholder capital. And so I think that it's important in their healthcare investments to also make that clear. Now, I think there are other benefits that can improve employee productivity, all those other things, and those should be done as well because they do improve return on capital. But I would say that for evaluating everything, employers should be thinking about what is the ROI of this solution? Is it actually delivering real outcomes? And when I say real outcomes, I mean hard dollars saved in RX and medical, not the fluffy 10 years down the line, I'll save you, $1 million from the heart attack that may or may not happen, but in-year hard dollar savings.
I guess I would also say that, there are so many companies out there, and some are going to survive and some aren't. So one of the things when we talk to employers, we say is find out what the funding is, find out what the scalability is, how many employees do they have. For example, if someone has 8 employees, they're not going to be able to deliver a solution to a 200,000 person group. So I think just thinking about what is the solution and what does the company look like, what's their funding and their viability is really, really critical.
One of the things that I think about a lot on this, that the question alludes to, is just this innovation tax that employers are faced with. Mm-hmm. It's really hard to experiment in healthcare. If you kind of step outside of healthcare and you think about what technology has done to other industries, right? You can experiment really quickly, you can experiment really cheaply, and you get great data out of it. Yeah. You get into healthcare and you're talking about selecting a program partner or a digital health solution, and it's really hard to figure out which one to do. You have to go through a ton of diligence. You have to go into even what you're talking about, looking at their funding and their employee base. And then once you do figure it out, you have to integrate with them, which is really hard, right? To just as an example, exchanging eligibility is really challenging for a benefits team, especially if it's not a 100% benefits team. And at Collective Health, we call this the innovation tax for employers. And I think it makes it so that there's a lot of room for disruption for aggregators and platforms to make it a lot easier for employers to engage with these digital health solutions, but then measure that ROI that you're talking about and really say whether or not that solution in particular for that member was what made that difference, because you're able to see what another member similarly situated that wasn't engaged, how their result came out. And I think that that's really, really important, and that's what we're doing at Collective Health.
I think what's really hard is employers don't have the expertise to evaluate these solutions. So there are a lot of very sophisticated people in benefits and wellness, but they don't have the time or the ability to do it. And so, they get this parade of vendors. That's where the consultants come in a lot of the time. But I think some organizations like Collective Health, you've done a very good job of curating those solutions and evaluating them for employers. A lot of health plans are doing that, and other entities kind of partnering with point solutions and being able to push those through to employers, pre-vetting them. Okay, so we only have like a minute left. So if you could wave a magic wand and fix one thing in healthcare for employer plan sponsors, what would it be?
I would do 2 things. Maybe just introduce choice and align incentives.
Okay.
At Collective Health, it makes me crazy every day how many times we talk about just the limited choice that employers have. If you're in Atlanta or California, and what sort of provider system you get to integrate with, what sort of network system you get to integrate with, you're always restricted in your choice. And then I think the incentives are really crazily misaligned. And so if I could do one thing, I would try and change those 2 things.
Just talk about which type of incentives quickly.
Yep, we can talk about it a lot more over a cocktail as well, or maybe 2 or 3. But I think that the misalignment of providers wanting to make people healthier, the payer being in the middle, and then the employer then becoming the payer as well, it's ripe for misaligned incentives. Sorry.
Totally agree. Okay, we're at time, but quickly, very quickly.
I'm kind of on Shauna's misalignment. Mm-hmm. We would eliminate any primary care treatment from the HSA high deductible. Why is a preventative visit not part of your deductible? So we drive you to primary care to have a preventative visit, but guess what? If we find out you're sick, You have diabetes, for example, all of a sudden now, if you come back to your primary care physician to treat you, now we're going to start dinging you against your deductible. We don't understand. That's a misalignment of the tax code and health of the patient.
Okay, Anand?
Only pay for outcomes.
Great. Okay, good. Well, thank you all very much. Thanks for the great questions from the audience.